Hi guys, my name is Hesham. In this video, I'm going to discuss ischemic heart disease, which is also known as coronary artery disease. So there are multiple classifications of ischemic heart disease, but in this video, I'm going to classify them as stable vs acute coronary syndrome. So the stable ischemic heart disease includes stable angina and microvascular angina, which is also known as cardiac syndrome X. The acute coronary syndrome include NSTEMI, STEMI, and unstable angina. Also, there are other types such as metal angina, which is also known as vasospastic angina. Okay, so the most common cause of angina is due to atherosclerosis of the coronary vessels, which lead to occlusion of the coronaries. As a result, there will be mismatch between oxygen supply and demand. So if the oxygen supply is down or demand is up, it will develop the symptoms of angina. Okay, other causes include coronary artery vasospasm, thromboembolism, coronary artery anomalies, microvascular dysfunction, which means it includes a small vessel of coronary artery. As a result, if you do the conventional coronary arteries, it will come back negative because the coronary artery only detects the big vessels. So small vessel will not be detected. Or decreased oxygen supply, such as hypotension, anemia, or increased oxygen demand, such as hypertension and tachycardia. Okay, starting with stable angina is due to fixed atherosclerotic plaque. So the stenosis reaches more than 70% of the lumen of the coronary vessel. Usually, if it's lower than 70%, it's asymptomatic. But if it's more than 70%, it leads to stable angina. If it's 100% occlusion, it will lead to the symptoms of NSTEMI and STEMI. So it's due to mismatch between oxygen demand and supply, and it's asymptomatic at risk because at the basal heart rate and contractility, the oxygen demand matches with oxygen supply. But if the patient increased the heart work, such as increasing stress or physical activity, it increases oxygen demand. As a result, symptoms of angina develop. So it will be relieved by easy rest or taking nitroglycerin, which acts as a vasodilator. Symptoms usually get relieved within 5 to 10 minutes, as compared to acute coronary syndrome, which may last more than 20 or 30 minutes. Okay, acute coronary syndrome is due to plaque rupture or erosion in the coronary artery, which lead to thrombus formations that obstruct blood flow. So it will lead to myocardial ischemia, necrosis, inflammatory response develops, and severity and outcome vary with the degree of occlusion, such as unstable angina, NSTEMI, and STEMI. So as you see here, we have 3 types. The difference is non-STEMI is characterized by subendocardial necrosis, STEMI is transmural necrosis, and the unstable angina, the symptoms really vary based on the plot. Regarding the troponin and CKMB enzyme, usually STEMI and non-STEMI are positive, and the unstable angina usually is negative, but sometimes it could be positive. And the third differentiation is the EKG changes. In non-STEMI, ST depression, STEMI is ST elevation. It's unstable angina, it's usually non-specific, but you may find ST depression. The metal angina or vasospastic angina is due to vasoconstriction and usually due to endothelial dysfunction. So there are some triggers like stress or cold exposure or taking certain medication like alpha agonist. So the treatment of metal angina differ from other types of angina because you don't want to give beta blocker. You just want to give like medication such as calcium channel blocker. The ischemia is transient and reversible.